So, bearing into consideration the mechanism of action for Tribitor, we can, indirectly and directly from the data, try to work out which, are good candidates for Tribitor. So we sort of distinguish those categories that might benefit from Tribitor as an adjunct. So 6 categories. I'm just going to go through each one, okay, to just try and give you some evidence to back it up as well. So starting with Tribitor from a clinician's perspective as an adjunct to management of prediabetes, so those people with insulin fasting glycemia, insulin glucose tolerance and metabolic syndrome, along with lifestyle modifications that we talked briefly about at the earlier part of the presentation. The study to prevent non-insulin diabetes mellitus trial has presented data basically indicating that treatments of subjects with impaired glucose tolerance with the acarbose, the alpha-glucosidase inhibitor, at 100 milligram 3 times a day was associated with significant reduction in the risk of progression to diabetes. Also, acarbose treatment, so an alpha-glucosidase inhibitor, was shown to be associated with a significant risk reduction in the development of hypertension and reduction in cardiovascular complications, heart attacks, strokes, and their complications. So therefore, postprandial hyperglycemia is known to be an independent predictor of diabetes development and cardiovascular risks in pre-diabetic people and also in obese people. Acarbose, which is used to be one of my favorite basically tools in the management of pre-diabetes and diabetes, is restricted in its use by the adverse gastrointestinal basically profile. So lots of upset tummies with flatulence and diarrhea restrict its use. For mulberry extract, there has been no proven adverse GI effects, and it has been shown to be very well tolerated, so tolerance was very good and there were no dropouts from the studies. And I believe that from Kasia's studies you have had nothing to suggest digestive upset. So again, the active ingredients, all 3 of them in Tribitor, were shown from the randomized controlled studies and from the meta-analysis to be quite safe as far as we know. So therefore, as a clinician, without any, I don't have any concerns about Tribitor's safety issue. There is good evidence to support the use of alpha-glucosidase inhibitors. Tribitor has more than alpha-glucosidase inhibitor action, so has a triple effect. So therefore, I'm very happy to use Tribitor up to twice a day before carbohydrate-rich meals in pre-diabetic individuals alongside lifestyle modifications, especially in subgroups of people who have a known sweet tooth and just go for a rich in carbohydrate meals anyway, despite knowing about the potential risks. Another niche for Tribitor is an adjunct to weight loss. So in obesity and overweight cases, along with lifestyle modifications as well. So going back to what I tried to elaborate on at the earlier part of the presentation, although we have pharmacological treatments, we have diets, okay, that we can recommend to our obese and overweight patients. It's all very subjective, and at the end of the day, it's personalized. And although both the patient can be, despite the commitment from both sides, the clinician and the patient, there is a high failure rate, okay, when it comes to weight loss and weight loss maintenance. So the drugs that we have available universally is mainly orlistat, so a lipase inhibitor, and we don't have many other options apart from the US, where the FBI has approved 5 more drugs, as I said. So therefore, for the rest of the world, I don't know about, I think in Europe as well, I don't think that any of the FDA-approved drugs are approved for weight loss. I think it's just Orlistat. So we don't have lots of pharmacological treatments left. So therefore, nutritional supplements with an ability to help with weight loss are a valuable tool. So Tribitor has been proven to reduce postprandial glycemia, insulinemia, and the GI, the glycemic index. So therefore, people with a sweet tooth and carbohydrate-rich diets that do not accept a dramatic restriction of dietary carbohydrates, cannot commit to a low-carb diet or a low GI, they can be helped because Tribitor can transform their diets into lower GI diets anyway. So another, extra potential helpful mechanism of action of the amylase inhibition through Tribitor is delayed gastric emptying, and basically, therefore, the delayed gastric emptying could strengthen and increase satiety, which is a very, very important and helpful mechanism to be present in any weight loss regime. Another category of patients are those with abdominal obesity, so visceral adiposity. It can be diet and exercise resistant, and this, at least in my practice, is a big chunk of the people that I see. People who exercise, they just, they commit to low carb or low glycemic or low fat or hypocaloric diet, they fast, they restrict energy, and they still have. Okay, excellent. So Pereira and al. Demonstrated that the consumption of 2 daily low GI meals for 45 consecutive days has a positive effect on obesity control, whereas the high GI had the opposite effect. So therefore, Tribitor can help. A very important category is also people with emotional eating and sugar cravings. Remember what Kasia said. Tribitor help with reduction of postprandial hyperinsulinemia, therefore reduced postprandial and late phase hypoglycemia, reactive hypoglycemia. So therefore that can help with reduction of sugar cravings. And you can just go through the slide for more details and a review of meta-analysis. Also, Tribitor can be an adjunct to lower meal GI in unhealthy sedentary lifestyles with life coaching, patient education. There is a meta-analysis, several actually meta-analysis showing that low GI meals are beneficial in the primary prevention of diabetes. And then we've got, the use of Tribitor as an aid towards lower GI meals in habitual late night eating and shift workers, a very important category. Those people have an increased risk of diabetes. So we found that, late high GI meals predispose people to diabetes and the complications. So Tribitor can help when we can't really help eating late. And also Tribitor and anti-aging. I'm just going to say that basically skin anti-aging is very important for women, for consumers nowadays, and sometimes beauty comes from within. So therefore, Tribitor can be used in association with other anti-aging strategies because it lowers GI glycemic index. Therefore, it reduces the age, the advanced glycation end products, which are important for collagen aging, basically. So it can be used together with other skin rejuvenation treatments for anti-aging purposes. So this is my conclusion. Okay, so very good timing. Tribitor supplement has been proven to reduce food glycemic index and in turn postprandial glucose and insulin levels in vitro and in vivo. It is composed of 3 safe, active ingredients already been studied in trials, found to be effective in terms of impaired glucose tolerance and weight fat loss. It is palatable, it is user-friendly at twice a dose intake, and clinically, myself as a clinician, I think it can be introduced as an adjunct to lifestyle treatments for obesity pre-diabetes. And additionally, it can aid in the management of carbohydrate cravings, may mitigate the impact of carbohydrate-rich diets on glycemic control. Also, as an anti-aging supplement for skin and other benefits in healthy people. So, thank you very much for your attention.